Hi everybody, my name is Sally and I help everyday people just like you with their movement, mindset and health. On today's episode of Sally Says, I have Dr. Bobby here today. Say hi, doctor.
Hello.
So tell us, Dr. Bobby, what do you actually do?
I'm a cosmetic and implant dentist based in Bondi Junction, Sydney. And I basically deal with a lot of people that either have missing teeth, broken down teeth, gum disease, or people with loose dentures that want replacements with implants. I also deal with people that aren't happy with their smile.
Awesome. So as you can guess, today's topic of the day is oral health, and does it affect your overall health? Now, this is a topic that not a lot of fitness professionals talk about, but I thought it would be great session to talk about something like this because it's in the back of our minds. It's certainly in front of us when we look in the mirror.
Absolutely.
But today we want to touch on some top tips on how to improve your oral health and what happens if you just don't take care of your teeth. Now, I had a quick look online, and I love looking at the World Health Organization, and they indicated that your oral health is a good indication for general health. What do you think about that, doctor?
Absolutely. Quite often, as with people, ophthalmologists also see a lot of diseases within the eyes before patients actually know that they have them. So a lot of signs and symptoms present in the mouth before patients have actually even been diagnosed. Another reason to maintain regular checkups and cleans. There is a direct link. It's been studied for a number of years, and now there's conclusive evidence that mouth and gum disease, especially oral health, is directly related to heart disease.
Amazing.
Particularly general types of heart disease, but also stroke and also diabetes, particularly type 2 late onset diabetes. If you have infection in your mouth, ultimately gum disease is infection of the gums, known as periodontitis. Peri meaning around, dontitis the tooth, so it's disease around the tooth. It sort of eats away at the bone, and it's there. So that sepsis, along with things like, let's say, a root canal treatment that hasn't healed, or a tooth with an abscess, or decay in your teeth, as well as broken down teeth, because quite often they have gum disease and decay with them, that bacterial load doesn't stay just in your mouth. That reaction with the bacteria with your gums is why you get inflammation and bleeding gums, okay, and then end up having bad breath. But that bacterial load, because you're a system, travels into your bloodstream and through your system. So it's going through your liver, your spleen, your heart, and your entire makeup, and therefore it's extremely important for your general health.
So are you saying, could it affect your immune system?
Yes, massively. What your body usually happens is that it goes into overtime with the immunities. That's why I mentioned diabetes, because people with diabetes, especially late onset diabetes, or people that are either obese or morbidly obese, have the situation where that bacterial load is causing your body, not only does the diabetes mean you have a poorer circulation to your extremities, but your healing is not as good with someone that does not have diabetes. And that infection is therefore your body is concentrating on those areas and trying to cure that area where you're continually producing more and more bacteria and more disease, rather than concentrating on your body as a whole.
So let's throw this in the mix. You have an onset of type 2 diabetes, lifestyle disease. You don't exercise, you smoke, you're really busy at work, you're very stressed. Is that like a really strong combination for any other kind of, are they like precursors for any kind of other diseases on top of that? Is that a formula for, is that a bad formula basically for health?
It is.
And do you see that happening?
Yes, you do. And unfortunately, what happens is when people, they've gone through fad diets, or they go to trainers where they're not really getting something that's engineered towards them, because people aren't understanding their body type. So they're trying to do, one size fits all type of theory with that type of thing. And people get defeated or become, they just don't feel like going back. So they tend to go hand in hand. So, somebody's going, right, I'm starting this new lifestyle, I'm going to eat well, I'm going to go to gym and get healthier, I'm going to stop smoking, I'm not going to be so sedentary. And when something fails, for example, they're not getting what they want or seeing the results out of their training, they tend to go back to smoking, not going there sort of, okay, I can't be bothered because it doesn't work. And that combination creates basically a base for other diseases to come along. The reason infectious diseases are what they tend to do, bacteria are opportunists. So you have a number of bacteria inside your body that are your basically healthy bacteria, but in controlled amounts. And there's always some of the bad bacteria in there, but they're being kept in smaller numbers by the good bacteria.
So there's a balance at some stage.
Exactly.
Your body wants to always maintain homeostasis.
Exactly,
Yeah.
it does. And that's better. If you're exercising, you'll find all of that is better, and eating right. And, you know, that usually goes hand in hand if you have a good personal trainer. Now, what happens is that if you have an unhealthy system, what tends to happen is that these bacteria that aren't meant to be there in large numbers suddenly use it as an opportunity to proliferate and multiply, because their main purpose in life is to populate the area, and that affects your whole system.
Wow, that's amazing. So I guess like some tips in terms of exercise. I mean, like all this stuff seems really overwhelming to a lot of people, especially if you smoke, if you don't do any exercise, you've got a little dental issues. And I've seen a lot of people who don't, I'll be honest, doctor, like people get scared of the dentist.
Yep.
I get scared ever since I was little, and we kind of push it aside and think, I'll be fine, I'll be fine. How far along can you say I'll be fine until something pops up?
Yep, this is mainly the problem, that there's signs and symptoms. Symptoms are what you feel, you see in your body, or you can feel. Signs are what I can see, you know, a trained professional can see. And quite often the signs way precede the symptoms. So if you actually see a health professional or you see someone, they can actually see that something is happening way before it's manifested, and you know that it's actually going on. And ignoring it is not the way forward. The consequences of those are quite severe, and what usually happens is that you then get into a situation where there's a lot of work to do, and that creates a panic, and you get into this catch-22 situation. And you can do a number of things to improve that situation. First and foremost, go and see a health professional. And
Seek help.
Yeah.
Number one,
seek help. And as you said, like it's difficult. When people come in and see me, that initially, you know, the main thing that they're getting over is feeling embarrassed. They don't want to talk about it. You know, it's a real personal thing, and I'm sort of instantly invading their personal space because they have to lie back. They're in a vulnerable position for me to have a look. So what we try and do here, I deal with a lot of very nervous patients and patients that are quite extreme cases. That's not only what I deal with. You know, a lot of that comes to me because I teach that subject, I lecture in it, but I also do some of the simple cases. But when those people come to me, or whether it's a simple case or complex case, the first thing we do is just sit down and have a conversation, and I listen. Because out of that, I'll get what their actual goal is, what they're feeling right now, and here is the problem and how they feel. And then it's my job to basically find a number of options to solve that with different costs and different lengths so that they can actually manage that. And that makes them feel like they have the resources and somebody on their side.
So start with the basics and bite-sized chunks.
Yep.
Just like, funny teeth, bite-sized chunks. Start with the basics. Like if it's really hard to exercise, get out and walk.
Yes.
Increase your non-exercise activity thermogenesis. That's just like doing daily activities. Increase those steps. That's the basic things. Drink more water. Eat real food. Start cooking again. You know, see a dentist. Brush your teeth. You know, just do the basics. It doesn't have to be super overwhelming. Just start with the base, and you can always work on that. It's always progressive.
Exactly.
Okay?
It's those small building blocks, and then you get to where you are. And quite often people come in and they're, oh my God, there's so much to do, my mouth is terrible, and everybody's their worst critic. And what we do is we usually make that plan into smaller little, manageable pieces. So not only does that mean that it's manageable financially, but it's also manageable in terms of healing and what somebody can take who's already coming in feeling that they're quite scared of the whole procedures and everything else. We'll still get from A to B. It just means that we'll take smaller steps in between, and it might take a bit longer, but that doesn't matter. At the end goal is to have a healthy mouth and something that is stable for a long time. So you're not constantly, a lot of people coming and saying, I'm constantly going to the dentist and there's always something to do. You know, that shouldn't really be the case. And when people come in, I try and basically cure everything and resolve that and make them happy. But if there's certain things that are in the balance and we're not sure which way they're going to go, we mark those out and they're aware of those.
And just like fitness, you've got to start somewhere. Start now, because later on it's going to be harder. You're going to be older. It's going to, it's going to cost you more. Okay, so my top tips for any kind of fitness or even with the dental stuff: nip it in the butt straight away.
Absolutely. If you come, the reason people tend to come in 6 monthly is that's the rate at which decay goes through teeth. And at that point, if you come in 6 monthly, the procedure is usually tiny. We can sometimes avoid any treatment whatsoever by various options and solutions, or minimal treatment, and that means that can be resolved and nipped in the bud. So you just want to start out with some basics. You should be using brushing twice a day. And for the 3 minutes, 3 minutes in the morning, 3 minutes in the evening before bed, you should be using a mouthwash. You need to be flossing. If you find it difficult to floss, come and see your dentist. They'll find you alternative ways of cleaning between the teeth. 40% of the surfaces in your mouth are the ones that are in between the teeth that you can't get to with a normal toothbrush. So flossing is essential. They're the basics, same way you would with going to see someone to improve your health or personal trainer. No matter where you are, you just start off. And if you've got a good personal trainer such as Sally, and I can say that because Sally trains me. Okay, and it's taking those small steps and managing it so that people are pushing themselves a little bit further than their comfort zone, but not so far that they go, right, I don't ever want to go back, and I feel like I've been run over by a car. Okay.
Yeah, and what's interesting? We invest so much in our cars, in the material things. We get a tune-up, we wash it all the time, detailed. But when it comes to something we use every day, every moment, every minute to speak, to show affection, to look good, it's like...
Yeah, people leave it last. I mean, the words come out of this, and we're now unfortunately living in a very sort of superficial world, but that's not the reason that you should come in. However, people look at you and they judge you by your teeth, because that's where the voice and the words are coming out of there. And it's amazing how people just leave things. If you had blood coming out of your eye, you'd be to the doctor straight away that morning in a panic. Yet blood coming out of your teeth and bleeding teeth tends to be left to the end. You need to love yourself and take care of yourself.
Dr. Bobby, does that mean I can't have any Kinder Surprise?
Just the one.
Just one. I guess it's all about, creating some kind of balance. I do love my apples, but I do love the chocolate. Let's be real. People are going to eat these things.
Of course, that's fine. But it's if you're monitoring something, then you can manage it well. If you're not monitoring it, you're like, I think I had 2 Kinder eggs last week. And then you're looking and go, actually I had about 9.
Wow. That's a lot of Kinder Surprise.
So that's important, Sally. I think having that balance and not being a completely clean diet, because nobody can stick to that. It's not long term.
Let's be real.
Yeah.
Okay, so top 3 tips just to keep the oral health in mint condition. Can you let us know? Top 3 tips.
Okay, top 3 tips. I suggest electric toothbrush, flossing, mouthwash. Simple.
Is that all?
That is it.
And then?
Then go and make sure you have maintenance. And what maintenance is, go and see a dentist and go and see a hygienist 6 monthly. If you find that you're getting a lot of build-up and you tend to get a lot more bleeding gums or bad breath, go 4 monthly. It's actually quite nice. Once you get to a stage where it's like a very easy clean and easy checkup, it's just like everything else. You go and whatever, well, not myself, but if you go and have a haircut or you get your hair done, you feel good. It's the same way. People feel really good. And I find that people that start to come in more regularly sort of say like, no, can I book my next appointment before I leave? They're dead on it.
And it's that self-care, because once you start caring about you, it exudes confidence. It affects you every day. It affects your performance at work, talking to people, relationships. You know what? It's definitely worth the investment. Thank you for joining us today. Thank you, Dr. Bobby. And you know what? Your general health is definitely affected by your teeth, and your teeth are definitely affected by your everyday health. Thanks for joining us today.
Thank you. Thank you for having me.